Zimbabwe, through the Ministry of Health and Childcare, hosted the International Conference of AIDS and STIs in Africa, commonly known as ICASA. This international conference was being held in Harare, Zimbabwe at the Harare International Conference Center. The Ministry of Health and Childcare partnered with Sunrise Sign Language Academy to set up a community booth under the theme Embracing Disability and Sign Language in HIV.
Why are we here at ICASA? It is the inclusion of people with disabilities and others. Why? Teaching different things about HIV and other conditions which may happen. We are united and being supported by NAC, UNICEF, Shangiri, Ministry of Health, and Global Fund. They support in spreading this gospel about HIV and teaching primary counselors and nurses or nurses, doctors, and different health workers about disability and sign language. Thank you.
Well, the disability and sign language training with the Ministry of Health and Childcare in Zimbabwe started in 2018, and since then we've trained around 700 primary counselors and other healthcare workers. So we thought of actually including disability into the MLE or monitoring and evaluation systems within Zimbabwe. So what did we do? We sought actually to develop a data collection tool which have the indicators for the various disabilities. We are looking actually at the physical, the blind, the hearing, the intellectual, the mental, and the other disabilities. So we developed a data collection tool using the ODK. We distributed this ODK via the WhatsApp group, talking to the primary care counselors. We asked them to complete the ODK. 200 primary care counselors received the ODK and 162 returned it for data analysis.
On Tuesday, during this conference, MOHCC, together with Sunrise Sign Language Academy, presented just after the official opening of the village booth to tackle their topic, embracing people with disabilities and sign language in response to HIV. At this presentation was the Director of AIDS and TB Unit in the Ministry of Health and Childcare, Dr. Owen Mugurungi, who underscored the importance to scale up the work of HIV among key populations, in particular persons with disabilities. He also applauded the work done by the Ministry of Health and Childcare through the training of primary counselors to be able to bridge the communication gap between health workers and persons with hearing impairment.
I do remember talking to Dr. a few years ago. And it was on a subject of counseling, and we were saying, well, I think we've done well, technically, and then she said to me, there's a group of people that's up to date, and I can tell you it's more than 10 years ago, and we continue to play lip services. When the government discuss or say their issues, they say, oh, yes, we know about this, and we take it. So today I'm very proud to stand in front of you and say, my together with the senior the guy that stood up, we have started something. And this is truly the spirit of leaving no one behind.
Also at this official opening and booth presentation was Dr. Bernard Mazima, who is the CEO of the National AIDS Council, who then praised the work done by MOHCC and Sunrise Sign Language Academy in helping bridge the communication gap, and further called for more collaborations, and that NAC was ready to support this initiative to ensure leaving no one and no place behind.
And again, let me thank you for organizing this session. I am from NAC, and I understand from Carol, when she came and she said that, as part of the National Health Strategy, let's not leave people behind. Those with disabilities are such a group. So can we have a program? We have this program, can we be supporting it? And yes, we did that. But we are also together the training for primary counselors in sign language, for health workers. That is important. And we continue to work Sunrise Academy and applaud you for the role which you are playing. National Health Strategy is great to support. Briefly, from a personal perspective, I worked for 8 years at Rural Rehabilitation Hospital. And when I went there, before I went there, my appreciation of disability issues was quite minimal. I had not interacted with people with disabilities. During those 8 years, I saw a lot of breaking up of social issues, including employment, marriages, relationships. And I think we need to put up structures to protect people. So those who are making policy here should try and work. People like Dr. Buka, try and expand the things we should do to look at those things. But already what I do is important.
Also at this official opening was the head of nursing training in the Ministry of Health and Childcare, who praised the work done by primary counselors, but also raised the need to expand the training also to the nurses.
The most important thing on this program for the nursing services is the sign language. Many people come to the hospitals and they don't understand when someone doesn't know how to do the sign language. I'm happy to say that the nurses, some of them, they volunteered looking for a teacher to teach them during lunch hours the sign language. But today I'm here to say, as the nursing services directorate, we have reviewed our curriculum and we have now included the sign language.
UNICEF was also present to offer their support for this program, and they underscored the need to continue collaborations with Sunrise Sign Language Academy to further train more health workers, and most importantly also to further scale it up to even nurses.
In terms of resources, I think as UNICEF we have partnered with the Ministry of Health, partnered with the National AIDS Council to support the training, and we're particularly proud in the sign language training, and I'm happy to see a lot of the faces of the people that we supported in partnership with the Sunrise, the National AIDS Council, and the Ministry of Health. So with that, I would like to say we have a lot more work to do in terms of increasing access, increasing participation, and just general acceptance of people living with disabilities. I think we have to start in the communities, and we are the communities. Each and every one of us, please let's stop hiding people in their homes if they are living with disabilities. Let them come out, let them participate, and the UN, including UNICEF, is on hand to support the process of inclusion of people living with disabilities in every sector, not just health, in education, in employment, and any other sector.
The booth presentation was unique also as it had Tambudzai Karimanzira, a primary counselor with visual impairment, who was helping to coordinate the booth presentation, and she also showcased her skills in signing despite having visual impairment. She also underscored that it is important that as a person with a visual impairment, she thanked the MOHCC, NAC, and also Sunrise Sign Language Academy for affording her the opportunity to learn sign language and be able to offer HIV testing services to patients with hearing impairment.
I am so happy to be here talking in front of you. It is because of some other people who have encouraged me, who have recognized me, and including the Ministry of Health and Child Care, who have recognized me. I'm so happy because I can sign my name and so many things. So I also would like to acknowledge the presence of Dr. Luka, who has recognized me from afar in Mutoko district.
Also at the 22nd edition of ICASA 2023 was also Nyasha, who is an accountant by profession but has a physical disability, which happened recently.
I'm an accountant by profession, and I lost my job this year due to being on a wheelchair after an accident. These are some of the challenges that we face that comes with some parts of our community not embracing disability integration. Being disabled is not being able. Disability is not being. We are able to do so many things that any other normal person can do.
Thus, in a nutshell, ICASA 2023 was a hive of activity as many visited the Sunrise Sign Language Academy booth, and also not to mention, we want to thank Dr. Lupka, who steered this program through MOHCC from 2018 to date.